Hi everyone, hope you're all well. I'm speaking here today on behalf of Usha, who's in India at the minute, and our fantastic team out there, our Indian trustees and UK trustees, to first and foremost continue to thank the Jazba community for all that you do and have done over a decade for women and girls in central India. I've been asked to try and sum up, and it's hard to sum up the true impact that Jazba has had on the lives of those women and girls that Women in Need and our Indian partners start support and have supported for 25 years. Gosh, where do I begin? On average, we are impacting the lives of 6,500 women and girls every year. Impacting in multiple ways. We provide screening for cancer, free transport to hospitals, vocational training, educational sponsorship, medical treatment, social outings. We have a mobile medical facility that gets right into the heart of the poorest communities to support women who would normally never access that care because of the constraints of money and time. We cover so many things, and yet we're a very tiny organisation on paper. Our premises in Nagpur, for those of you from Jazba who have visited, will see and know how modest our headquarters are. And I would like to say that I hope is a reflection of the fact that money given to our organisation goes to where it needs to go, and that is supporting the most vulnerable women and girls that we encounter as an organisation. The scale of the problem is enormous. You're dealing with a massive population, even in the area that we work alone, Nagpur, the district of Nagpur, so not just the city, the district. You can only do what you can with the resources that you have. And our goal has always been, rather than quantity, but quality of care. If somebody's money is going to impact another person's life, we are the custodians of that, and we are responsible for that impact being significant enough to really make a change in that individual's life. And that's, I believe, one of our special qualities. So, Jazba, the funds that you have donated over a decade have saved life, provided dignity and hope. I have lived the experience of the charity's work for 22 years in India. I've seen firsthand from the very beginning of our work just the real impact that funding can have on the lives of women and girls who live on the fringes of society, who have no, it would appear, significance or importance to even their families, because when it gets down to it, if a woman has a health problem and is unable to afford treatment, then she ceases to be of any value or use to her family. And this is a very sad fact that I have seen and witnessed time and time again. Women who have been left in the grounds of government hospitals, abandoned on streets, simply because they couldn't afford their medical treatment. Your money goes directly towards medical treatment. You are saving lives. You are catching diseases early. You are improving quality of life. You are also, on occasion, improving the quality of dying. it's very difficult to put a price on the value of that.
Namaste, Jazba. I would like to thank Mr. Anish Chandak and all the 10 years executive committee and members. Thank you so much for your support last 10 years, and you have been really great support to all those women. Thousands and thousands women receive your help last 10 years. You given them hope, you given them dignity, and then you given them life. You know, when they go to government hospital with a big hope that they will get free help there, but what happens once you go to government hospital? Charges are there. There is nothing free in government hospital. Top of that, you always need sonography, CT scan, MRI to detect the diagnosis. But you know how much it costs just to do MRI? 6 to 8,000 rupees, which is $85 to just do one time CT scans or MRI. CT scan also cost nearly 4,000 rupees, which is they can't afford. Women earn every day to have a food just $3 or $2 a day by doing labor work, domestic work, or farmer to just feed herself and her children. Now you can imagine having to pay $400 to $500 to just do the test for diagnose. They can't afford it. There your help, your money goes direct to that to investigate further investigation for their diagnosis so they can have chemo or treatment. Treatment also not free there. Medicine, common medicine also not available all the time. So how they can pay? So there your money goes. Jazba, we are so grateful. What a privilege for me to go in their home, listen to them, and they share their problem, how they face the problem, not just having disease, but stigma as well surrounding in their home, socially. They hide. You know what? People also think that, having cancer, you can get cancer from them. That education is not there. Having to live that fear, you know, but you give them hope by just helping them having treatment, food, you know. So thank you so much. You take out your time, even though you're doing study, your effort, your time, your effort, your family and friend. We are so grateful for your family and friends as well. Their support to you, and you making happen this every year, and you are saving lot of life. So thank you again.